Hello, listeners. Welcome to Health Talk Radio Africa. I am your host, Dr. Mary Mugambi, a dietitian. Listeners, we are back after a short break. I thank the listeners who reached out to ask why we had become silent. Special thanks to Catholic Women Association of Holy Trinity Catholic Church in Kileleshwa, Kenya. Listeners, sometimes we go silent to scout around and ask people what health and nutrition problems they are facing. Then we designed this podcast to answer your health and nutrition questions. We encourage you to challenge us with any health and nutrition questions you have. With that, let us jump into our program. Listeners, the birth of an infant often brings happiness to the parents of the infant. Other times, the birth can bring confusion and sadness when HIV is diagnosed. A listener called Mumina from Kwale emailed and asked the following question. Dear Dr. Mugambi, I am a young 20-year-old mother who delivered a baby a few days ago. I am HIV positive. I am so confused on how to feed my baby after being given a long lesson which I did not understand. I really want my baby to thrive. I wash clothes for a living, which means I do not have a lot of money. HIV medications are hard to come by in my area. The local clinic often runs out of medication. Please help me. Tell me how to feed my baby so she lives. I am breastfeeding, but I am not sure if that is good for the baby. Dr. Mugambi, am I killing my baby? This is my reply to Mumina out there. Mumina from Kwale, thank you for writing to me. All your questions will be answered in today's podcast. Listeners and Mumina in Kwale, in today's program, we discuss how an HIV positive mother can feed her infant. Listeners, the HIV virus has been with us humans for several decades. The question faced by HIV positive mothers after delivery of a baby is how to feed the baby. Listeners, there is no one answer fits all. To get answers, my team and I went to the World Health Organization's guidelines on infant feeding for mothers living with HIV. We have simplified the guidelines here for you. To answer the question, how does a mother who is HIV positive feed her baby? We present 4 scenarios that an HIV positive mother may face and how the World Health Organization recommends. Scenario number 1. An HIV positive mother gives birth. She has continuous lifelong access to antiretroviral medication from healthcare institutions. Antiretroviral medication in our case here is medication for HIV positive people. This mother has decided she can exclusively breastfeed an infant. The World Health Organization recommends that if a mother has continuous, lifelong, uninterrupted access to antiretroviral medication, she can exclusively breastfeed for the first 6 months of the infant's life. Exclusively breastfeeding means that the infant cannot be given any other fluid, even water, just breast milk. At 6 months, the infant can be given food and continue breastfeeding until 2 years of age and beyond. Listeners, please note that the mother has to keep taking her antiretroviral medication during breastfeeding and cannot stop at all. Scenario number 2. An HIV positive mother gives birth. She has continuous, lifelong, uninterrupted access to antiretroviral medication from healthcare institutions. However, this mother has to return to work in a short time. She has a few weeks of maternity leave. She wants to mix breastfeeding and commercial infant formula. The World Health Organization recommends that the mother must strictly take her antiretroviral medications all the time. The time she's on leave with her infant, she breastfeeds exclusively. The mother can also give commercial infant formula. When the infant is 6 months old, the infant is ready for complementary food together with infant formula. The mother is also encouraged to continue breastfeeding for at least 12 months as long as she takes her antiretroviral medication. The mother can breastfeed the infant for 2 years and more. However, the World Health Organization recommends for any mother to give commercial infant formula, 6 conditions must be met. These conditions are presented in the next scenario. Scenario number 3. Listeners, here is scenario number 3. A mother who is HIV positive is taking antiretroviral medication but decides not to breastfeed her baby or to stop breastfeeding her baby. The World Health Organization recommends giving commercial infant formula when 6 specific conditions are met. These 6 conditions are: 1. Clean, safe water and sanitation are continuously available at the household level and in the community. The key words here is clean, safe water and sanitation. That cannot be compromised. The second condition to give commercial infant formula is the mother or the caregiver can reliably provide enough infant formula to to support the growth and development of the infant. Please note, listeners, infant formula is costly and may not be sustainable for many mothers. So she has to be able to afford and reliably provide enough infant formula. The third condition to give infant formula, the mother or caregiver can prepare the infant formula cleanly and frequently enough so that it is safe and carries a low risk of causing diarrhea or malnutrition. The fourth condition to give infant formula is the family must be supportive of the practice of giving infant formula. The fifth condition to give formula is the mother or caregiver can access health care that offers comprehensive child health services. And the last condition is for infants less than 6 months. The mother or caregiver can exclusively give infant formula in the first 6 months of life. That means that no other type of milk can be given in the first 6 months of life. No animal milk such as cow, goat, or camel milk. Listeners, please never give any animal milk to an infant younger than 6 months old. Now, for infants who are more than 6 months old, they must be given enough infant food at least 4 to 5 times per day together with infant formula. The World Health Organization also states that for an infant older than 6 months, animal milk can be given, but the animal milk cannot be added anything, just plain milk. Keep in mind that the infant must be fed 4 to 5 times a day. Animal milk such as cow, goat, or camel can be given to this child who is older than 6 months old. Scenario number 4. Listeners, scenario number 4 is the one that is the most common throughout the African continent. A mother who is HIV positive does not have access to antiretroviral medication and cannot afford to provide commercial infant formula. The antiretroviral medications are simply not available, or they are available today and tomorrow they are gone. So the World Health Organization recommends for the mother to express her breast milk and give the infant heat-treated breast milk. Listeners, you're asking, what is heat-treated breast milk? Heat-treated breast milk is also known as flash-heated breast milk. For the first 6 months, the mother should give only heat-treated milk, nothing else. After 6 months old, the infant can be given food and continue being given heat-treated breast milk until 2 years of age and beyond. As long as the mother continues to manually express her breast milk, she will maintain her milk supply. Listeners, you're wondering now, what is heat-treated milk? To make heat-treated or flash heat-treated breast milk, step 1, the mother must express or squeeze out her breast milk into a glass jar. The glass jar can be the type used for making jam or preserved fruit. In other words, the glass jar must be heat resistant. Add water to a saucepan or a pot and place the saucepan on high heat like a gas stove. Place the jar of breast milk inside the water. The level of the water should be 2 fingers above the level of the breast milk. Bring the water in the saucepan to a brisk boil. Once the water begins to boil, remove the jar of breast milk and let the milk cool down to room temperature. Give the breast milk to the infant using a cup and spoon, not a bottle. Listeners, please be warned. First thing is, please never heat breast milk in a microwave. This is to avoid hot spots that may burn the infant. Never put breast milk directly in a saucepan and place it over direct heat. Listeners, by now you're wondering, how does applying heat treatment affect the quality and nutrients of breast milk? Listeners, heat-treated or flash heat-treated breast milk retains its quality and nutrients. Many years of research have shown that flash heat kills the HIV virus. Therefore, the chances of transmission of HIV virus from mother to child are none. Heat treatment also destroys bacteria if the breast milk was contaminated. Breast milk also contains special molecules called immunoglobulins. These immunoglobulins are the ones that help the infant develop their immunity. Heat-treated breast milk does not destroy the immunoglobulins. The presence of immunoglobulins makes heat-treated breast milk superior to commercial infant formula. Heat-treated breast milk also retains many vitamins such as vitamin A, vitamin B6, B12, folate, riboflavin, and thiamine. There is very minimal decrease of vitamin C NE in the heat-treated breast milk. The decrease is not significant to cause any nutritional deficiencies. Listeners, breast milk has proteins that fight bacteria called lactoferrin and lysozyme. These bacteria-fighting lactoferrin and lysozyme remain intact in the heat-treated breast milk. The other nutrients also remain intact. The carbohydrates, protein, fat in breast milk are not affected by heat treatment. The World Health Organization strongly recommends that in developing countries, including majority of countries in Africa, flash heated or heat-treated breast milk is practical, viable, and a nutritious infant feeding method for infants born by HIV positive mothers. Listeners, that's all I have for you today. Thank you for joining me here at Health Talk Radio Africa. And thank you to Mumina from Kwale to writing to me. Today's episode, listeners, was brought to you by Anumi Prosthetics for women who have undergone breast removal surgery. I always welcome your comments on this program. Just drop me an email at healthtalkradioafrica@gmail.com. Remember, listeners, to subscribe and share this episode so we can help more people. Until next time, listeners, remember to eat healthy so you can live healthy. Bye. Bye for now. Bye-bye.